welcome to Polaris Collective Wellness. I'm Dr. Raleigh Warren, a functional medicine chiropractor that also specializes in pregnancy and pediatric. And this is Reka, our office chiropractic assistant. At Polaris Collective Wellness, I've gathered a team of like-minded professionals to help cater a specific care plan for each individual patient along their health and wellness journey. I'm going to be walking you through what it's going to look like for a new patient visit and what you can expect. Assuming you've already called our office and spoken to our wonderful office manager, and she's collected all of your information and email, you should be sent an email with new patient paperwork that is based off of what brings you in. If you're unable to do that, that's totally fine. Just come in 10 to 15 minutes prior to your visit so you can fill out the paperwork here. After you fill out the paperwork, we'll then take you back to my room as well as Ms. Reka with me, where we are going to go over what you can expect in that part of the room. Hi, and welcome into room 3, where we will go over what happens on new patient visit 1. So in here, we'll bring you back after you filled out your paperwork. Ms. Reka might be with me as well, as you can see. We will discuss about what brings you in, what your goals are, all the things that hopefully I, as well as Polaris Collective, can help you obtain in your life and health and wellness goals. On top of talking about what brings you in, we will also bring you over to the table afterwards, where I will palpate, I will do orthopedic tests, neurological tests. Again, depending on what brings you in, I will tailor my examination towards you. Total time you can expect between the time you come in to the time you leave on new patient visit 1 will be between an hour to an hour and a half. I will absolutely be more than happy to show you and discuss with you the types of techniques that I do, which I can discuss real quickly here. Table, this is a flexion distraction for both neck and low back, as well as a Thompson drop that if you know what that is, that's great. If not, I'm happy to explain that as well. I use that. I also use, if you're familiar with SOT, sacral occipital blocks, I use that technique as well to help align pelvis, as well as other things. I have my wonderful arthrostem that I love to use with all of its many tool heads, and the vibrocussor that I'm pretty sure is what brings most of my patients in, because it is pretty awesome. We do a little full spine manual adjusting as well, but that is also dependent on the patient as well as the case. All right, so after we've completed your new patient examination, our next step would be we'll take you back to the front desk where Nick will schedule you your report of findings, which will be on a separate day. If it's during the same week, that's great. If it's in the following week, that's okay too. We do try to get you in sooner than later, just to make sure, especially if it's an issue that needs to be addressed sooner than later, because we don't want you waiting or in pain. To mention, when you call to schedule for your new patient paperwork, most likely your insurance information was collected and will be verified as to whether you have coverage and to what extent. That information will be given to you at your report of findings. The payment that you made for the new patient visit will cover that visit as well as the report of findings. At that visit, at the report of findings, we will go over what your insurance does and does not cost or cover. And at that point, you can make an informed decision on if this feels like a good fit and a good place for your healing and total wellness to continue. Some patients that have questions about parking, and then we are absolutely happy to answer that. We do have parking below, underneath us. We are on the 2nd floor. So parking is in a covered garage. You are welcome to park along the back wall where there is bamboo, so you should be able to see that. There are also 2 spots right before you pull into the covered area that are welcome to visitors as well. And there are also 2-hour parkings all along the Corbett, along the back side of the building, as well as over by the tabernacle. So parking shouldn't be a problem, but if you have any questions or concerns, please give us a call and we'll be happy to walk you through that. So that concludes day 1 of new patient and day 2 of your report of findings. Obviously not in the same day, if they don't have to be, or I should say not back to back, of course. We are so excited to get to be a part of your health and wellness journey, and we look forward to serving you and the community as much as we possibly can. Be well.